Welcome back to Aging is for Everyone. We're talking about paying for health care today. Paying for medications, that's a big concern for many seniors. Here to tell us about the EPIC program is Gabrielle Dotterweich. Welcome, Gabrielle.
Thank you, Laura. Nice to be here.
It's great to have you here. Now, first of all, tell us, what is the EPIC program and how long has that been around?
EPIC is sponsored by New York State, and it is the elderly pharmaceutical insurance coverage. So it is state-sponsored prescription coverage for people who are 65 and older, and it's been around for 26 years.
Okay, so it's been around a little while, and I would imagine it's getting more and more popular as drug costs keep getting
absolutely
higher. Yeah. Now, first of all, to join EPIC, I know you said for people 65 and older, but are there any other requirements for EPIC?
Yes, there are. Again, you have to be 65 years old or older. You have to live in New York State as your primary residence. Okay. You have to meet income guidelines, and income guidelines go as if you are single, your income cannot exceed $35,000 per year, and if you're married, you cannot have income exceeding $50,000 per year. Our members have to have a Medicare Part D plan as their primary prescription source, and they cannot be receiving full Medicaid benefits.
Okay. Okay, that's pretty straightforward. Yeah. Now, if an EPIC member if somebody has EPIC, can they go anywhere to get their prescription filled, or is it just certain places?
Over 98% of the pharmacies in New York State accept EPIC. They will, though, have to use their Part D coverage first, and then EPIC would wrap around their coverage. Okay,
so can you explain how, if you have the Medicare Part D coverage, how that works with EPIC? You said it wraps around, but...
Sure. Once you're in Medicare Part D, and you go through some of their certain phases, there's many phases to Part D, you have your deductible phase, and this year EPIC for 2013 won't wrap around the deductible phase, but once you're using your EPIC benefits, you will never pay more than $20 for your prescriptions. We will give you coverage through the donut hole or the coverage gap, and we will give you coverage through the catastrophic level. What you do is you show your Medicare Part D card and your EPIC card to your pharmacy, and everything is done at the pharmacy, so they don't have to keep track of anything.
That's great. Okay. So how does somebody, if they're interested in being in EPIC or enrolling in it, how do they go about doing that?
We have a very simple application to fill out. They can get it at their pharmacy, they can call our EPIC program, our EPIC helpline to get one, or they can call their local Department of Senior Services to get an application. They need to fill in their basic information, their name, their address, date of birth, social security number, phone number. They need to provide their Medicare claim number, which is found on their red, white, and blue card. And then they need to give us their year's previous income on the back. And we are looking for social security. We are looking for their pensions, if they have an annuity, or they have to make a withdrawal from their IRA, their wages if they still have a little part-time job. We're looking for business income, rental income, any type of income that they had in the previous year. They mail the application to us, and we process it within 10 business days.
Okay, so there's a pretty straightforward way of enrolling. Now, I know that you mentioned that there's changes coming up January 1st to EPIC, so for those people who already have EPIC, they may be seeing it change. Can you sort of summarize what's going to happen?
What we're saying is the old EPIC is the new EPIC.
Okay.
So what is going to happen is this year in 2012, EPIC is doing two basic things. We're covering Medicare Part D premiums, and we're covering our members through the coverage gap. In 2013, we're going to continue to do both of those, but we're going back to what we call our fee and deductible plans. And what it is based on income, is whether you qualify for the fee or the deductible plan. And it also is based on your income if you qualify for premium assistance to pay for your Medicare Part D plan.
Okay. Can you do a brief explanation of what the difference is between the fee and the deductible plan?
If you are eligible for the fee plan, you have a yearly fee that you pay EPIC. If you are single, your income must be lower than $20,000 per year, and if you're married, the couple's income cannot exceed $23,000 per year. To be on the fee plan, again, you have an annual fee, and it ranges anywhere from $8 a year to $300, depending on your income and marital status. You get Medicare Part D premium assistance. So in 2013, Epic will help you pay your Medicare Part D plan, and we will pay up to $43.22 a month directly to whatever plan that you choose.
Okay.
The next thing we will do is we will lower your copays. So if your published copays with your Medicare Part D plan, we will lower them. For example, if you have a generic that costs $5 a month, at the pharmacy, the pharmacist will take that $5, bill it to Epic, and you will only pay an Epic copay of $3 per month.
Okay.
So the copays range anywhere from $3, $7, $15, or $20. They would never have more than a $20 copay once they're using their Epic benefit. And if they hit the coverage gap, they don't have to worry about it. They will never pay more than the $20.
Great. That sounds good.
So now the deductible plan,
Yeah.
a little bit more complicated,
more complicated.
But it's if you're single and your income is $20,000 to $1 up to $35,000, you're on the deductible plan. And if you're married, your income is up to $26,001 up to $50,000. You will be on the Epic deductible plan.
Okay.
And what happens then is you are assigned a deductible. And how you meet that deductible is anytime you go to the pharmacy and you pay a copay with your Medicare Part D plan, that copay gets put to good use. It starts chipping away at your Epic deductible.
Okay.
So once you've satisfied that deductible, then you get the Epic benefit of the lower copays and the coverage gap and the catastrophic coverage.
Great. Okay. Well, it sounds like, you know, people will definitely want to get more information about this, and you do have a hotline number. So
We do.
And we do have that on the screen for people as well.
Yeah, they can call anytime Monday through Friday, 8:30 to 5, and it's 1-800-332-3742 to get more information on Epic.
Right. They can see if it's right for them and get information on how to enroll.
Absolutely.
Excellent. Well, thank you so much for being with us, Gabrielle.
Thank you.
We will be right back with more Aging is for Everyone. Welcome back to Aging is for Everyone. We are talking about paying for health care today. And on this segment, I'm happy to welcome Tony Siegel, who's with Legal Services for the Elderly, Disabled, or Disadvantaged of Western New York. Okay. Welcome, Tony.
Thank you, Laura.
Thank you. Our first segment, we talked a little bit about Medicare. And where does Medicare come into play with long-term care situations?
Okay, Medicare does cover some long-term care. And when I use that term, I'm talking about primarily nursing home care and home health care.
Okay.
Medicare can cover up to 100 days in a spell of illness. The way it plays out is that there are really two major streams of people that are going into nursing homes.